Obamacare intends to put someone between you and your physician. It must be repealed. This $1 trillion bomb that Obamacare means to this country over 10 years is creating such uncertainty in the marketplace that businesses aren't willing to hire. They're not willing to deploy capital into the marketplace. It has gummed up our system.
There's a menu of options that we could have, just like John Huntsman talked about. That is how we go forward with our health care. Each state deciding how they're going to deliver that health care. Not one size fits all.
A lot of people are objecting to Obamacare because we need to get bureaucrats out of the business of trying to micromanage health care in this nation.
It can be and will be one of the topics in 2012. And some of the Republican candidates talking about how they will handle America's health care challenges if they get the top job. A new study on health care in America shows that many doctors think that patients get too much care. Is that true? And if so, why? Let's ask two of them this morning. Dr. Richard Fershine is director of the Fershine Center for Comprehensive Medicine and board-certified family physician. Dr. Ernest Patti is senior attending physician of emergency medicine at St. Barnabas Hospital. You men must be important because your titles are a page and a half long.
Good morning.
Good morning to both of you, and welcome here to America's Newsroom. Dr. Fershine, too much care in your view? Is the study right from your peers?
Yes. I mean, basically what's happening is the doctors who were surveyed found that 83% of them believed that their care was dependent on what we call defensive medicine, that they were actually ordering tests and doing tests in order to prevent problems like malpractice. Now that leads to a serious problem because it costs us billions of dollars. It's estimated over $200 billion in excess expenses every year.
So they're trying to protect themselves. Dr. Patti, do you agree with the findings?
I have to appreciate the study, but I have to tell you, where I work at a safety net hospital in the South Bronx, only a stone's throw from here, the majority of patients that I care for can't get the health care that they need. And they referred to the frontline physicians in the study. Well, in inner city urban areas like where I am in the Bronx, we are the frontline physicians, emergency physicians. These people do not have access to family physicians, which we all know would be able to deliver good quality, cost-effective care.
So you disagree with the conclusion, but I think what your suggestion is it depends on where you live.
Well, geographically, there are some stark differences in the ways in which health care is delivered in our country. I think we could all agree on that. And I know Dr. Fershine would have to agree with me as well.
What about that, Dr. Fershine, when you mentioned malpractice?
Well,
are doctors spending less time with patients because they've got so much to do in order to cover my butt? I've got to get this prescription out, or I have to order this MRI, and that way they can't come back and say, hey, you didn't check for this in the first place.
Well, that's specifically what they're concerned about. And the doctors who were surveyed, 76% of them said that they could be sued for not prescribing a certain test. And, you know, the particular problem here, and I would reference the emergency medicine departments, is that, you know, if you're in an emergency department and, you know, everyone is ordering specific tests, let's say everyone's ordering a CAT scan and radiologists have to read those scans, that can cause a lot of problems in terms of how those tests are read. If you have an emergency, if you actually have a concussion, if too many tests are ordered, the radiologist may not be able to read that. So overprescribing tests can lead to serious problems and shortages as well.
Dr. Patti, to his main point, if you or your peers were given more protection, whether you're serving patients in New York City or anywhere in the country, would you take more time with patients? Go ahead.
God, I'm sorry, Bill. Didn't mean to interrupt you, but I have to tell you, it's interesting how in this study, only 40% of the doctors felt that more time was needed. I have to tell you, the ability to practice medicine is not just a science, it's an art. And we need to speak to our patients, we need to examine them. And I agree with you, if we were given more time to take with our patients, then maybe in the long term, some more unnecessary tests might not be ordered. But you have to remember that patients don't have access to physicians in private offices in areas.
Listen, you're a terrific panel. I wish we had more time. We're going to bring you both back because it's going to be a big deal, not just in the coming year, but for years to come. Thank you, Dr. Fershine, Dr. Patti. Thanks to both of you.
Thank you, Bill. Thanks for having us.
Martha.